Good morning and welcome to Radio Doctor, your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on your Women Radio 91.7. Radio Doctor is broadcast from 10 a.m. Mondays through to Fridays. My name is Miracle Philip, and our Radio Doctor for today is Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Good morning to you, Dr. Abiola. Glad to have you join us today.
Good morning, Miracle. I'm glad to be here.
How are you doing today?
Fantastic. Sorry I was under the weather before, but doing great now.
All right. We're glad to have you join us today. On Radio Doctor today, Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital, will be consulting and advising on essential health screening every woman needs, from pap smear, mammogram, and more. So we'll be exploring this together on Radio Doctor. Don't forget that the phone lines will be open as well for you to be part of the program. The phone lines are 07000 917 917 or 9155 917 917. Our toll-free number for women, 0800 1235 917. And then we have our text and WhatsApp line, 08155 917 917, 0703 175 6537. These are the lines for you to get to engage us on in the course of the program, in case you have any questions for Dr. Abiola this morning. So let's delve in. Dr. Abiola, why are routine health screenings important for women, and at what age should they begin?
Yeah, this is such a dear topic to me because I so much believe in routine health screenings, and they're meant to detect diseases before symptoms develop, and this will lead to earlier treatment and better outcomes down the road. In Nigeria, number one cause of death for women is cardiovascular disease. Number two is cervical cancer, and cervical cancer is the most common cancer among women. About 10,000, at least 10,000 deaths a year, and most of those deaths are due to late detection. In the U.S., there's about a 90% survival rate. And in Nigeria, there's only a 33% survival rate. And the main reason is because of late detection, meaning we're not screening on time. So the routine screenings can also help identify risk factors so that women can make lifestyle changes to prevent illness. And that's something that you'll hear me talk about a lot, how to prevent illnesses with diet, lifestyle changes, and sometimes medication. So you asked about timelines. Right, so if someone is sexually active, they should get a HPV vaccine and be checked for STIs or sexually transmitted infections. A lot of young people feel like they're immune from having health screenings, and that's not true. 20s to 30s, your blood pressure is important, cholesterol, and we start checking for blood sugar or diabetes screening, and women are doing pap smears. In your 40s and 50s, women are doing mammograms, and you start checking your bone density, looking for osteoporosis. 60s and above, we add in colon cancer screening, and we do a lot more frequent heart health monitoring. This is kind of the timeline that I preach to my patients.
All right. Thank you very much, Doctor, for sharing this with us. There was something you said that had a caveat, and that you said if you are sexually active, does that mean that for someone who is not sexually active, they do not need to bother with some of the routine screenings?
Oh, that's a good question. That's primarily for HPV or human papillomavirus, okay. And that's the virus that causes 90% of cervical cancer. So if you're a woman, we try to vaccinate between the ages of 9 and 14. That's when the vaccine is most effective. It depends on whenever the woman gets sexually active, but pap smears are still important whether you're sexually active or not.
Okay, thank you very much, Doctor. What are the most critical screenings that every woman should prioritize throughout her life?
So the main goal of these screenings are to reduce sickness and death, right? So we go with the most common things. So cervical cancer is one of the most critical ones, and that's a pap smear and that HPV test, the human papillomavirus. We also, breast cancer is also extremely important, so mammograms, and your doctor does a breast exam in the office. Remember, we said heart disease is the number one killer of women and men worldwide, and so that requires blood pressure checks, cholesterol, and there's something called an ECG, which just looks at how your heart beats. For diabetes, which is also very high up on the list, we do something called fasting blood sugar and long-term blood sugar, or also known as hemoglobin A1C. And then, we talked about sexually transmitted disease screenings, and for colon cancer, we do something called a colonoscopy, like put a camera in. And we start at anywhere from 45, but yearly when you're 60. Those are the main ones. So we said cervical cancer, breast cancer, heart disease, diabetes, and colon cancer, sexually transmitted infections, all prioritized.
All right. Thank you very much, Doctor. If you've just tuned in, this is Radio Doctor and Your Women Radio 91.7, Nigeria's first and only radio station for women and their families. And we have with us Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. He is consulting and advising on essential health screening every woman needs: pap smear, mammogram, and more. That's what we're having to discuss today. Now, Doctor, how often should women undergo a comprehensive health checkup, and what should be included?
What I tell all my people, men and women, is a full health checkup. It should be done yearly. That should be your birthday present to yourself. There's nothing like giving yourself good health, and for you to make it easy for you to remember, just do it on your birthday. Some of the annual checkup checklist: blood pressure and cholesterol, at least yearly from age 40. Blood sugar levels, pap smear, and that HPV test, really, really important. Breast exams and a mammogram every year from age 40. And, of course, every time you come in our office, we check your blood pressure. But it's something that a lot of people get surprised when they come to the office maybe for malaria or something like that, and their blood pressure is high. And they're like 50 years old, and the blood pressure is high. Like, I never had high blood pressure. Yeah, it develops. One day it develops. One day you didn't have it. One day you do have it. And the more often you screen for it, the faster you catch it, and the less damage it does over time. So these tests are important to do usually every year.
Okay. All right. And Doctor, what is pap smear, and how does it help in detecting cervical cancer?
Yeah, pap smear is a test looking for abnormal cells of the cervix. The cervix is the window to the uterus. It's the area right before we get into the womb, and that area could become cancerous. And if you find these abnormal cells early, we can either prevent the cervical cancer from developing or catch it quickly. I talked about the HPV virus, or human papillomavirus. It's over 90%, in some cases 99% of cervical cancers are caused by this virus. So let me mention, the pap smear is painless, maybe mild discomfort at the worst. It only takes to be done in and out in 5 minutes, and it saves thousands of lives. In the States, pap smears have cut cervical cancer deaths by 70%.
Oh.
But in Nigeria, we still have a 66% fatality rate for cervical cancer. In the U.S., it's a 10% fatality rate. And the main difference is not the type of treatment, is when the disease was detected. And that's why this screening is so important.
At what age should women start getting pap smears, and how frequently should they have that done?
So easy way to make it simple. At age 21, even if you're not sexually active, you should get your first pap smear. And if it's normal, then you can go about every 3 years. If you have a normal one, every 3 years. If you have an abnormal one, then it's going to be a lot more frequent testing. When you get in your 30s, we do about every 5 years. And when you're 60, 65 and up, if we have 3 previous tests that were normal, then we can stop at age 65. We don't see cervical cancer starting after the age of 65, but start at age 21 even if you're not sexually active.
All right. Thank you very much, Doctor, for sharing this with us. And now I wanted to talk about this too, because I think a lot of people mix it up. Can HPV vaccination eliminate the need for pap smears, or should vaccinated women still undergo screening?
Good. That's a good question. The answer is no, it cannot eliminate the need. We said the HPV vaccine can prevent up to 90%, in some cases 99%, but there's still that does not protect against all cancer-causing strains. So women that get the vaccine must still undergo regular pap smears. And, I mentioned before, the vaccine is most effective when it's given between age 9 and 14. So every woman should get it. And if you're older than that, you can still get it. It's just a little bit less effective.
All right. For some people who are quite new to this word, pap smear, there might be some misconceptions. What are they, and how can women be encouraged to take them seriously?
Yeah, one of the ones I hear all the time is, I don't need a pap smear if I don't have symptoms. And it's important to know that the symptoms develop silently, and that's one of the reasons why we have such late detection in Nigeria, is because of cost and availability. People will not do the screenings, and then by the time you start seeing symptoms of cervical cancer, it has spread to other parts of the organ. It's devastating. So that's one of the first ones, that once I do a pap smear, if I don't need a pap smear if I don't have symptoms. Another misconception is pap smears are painful. It's mildly uncomfortable at the worst. And I guess the final one would be somebody saying they had the vaccine and they're safe. And we want to make that clear. As vaccination does not replace screening, but it does do a lot.
All right. Thank you very much, Dr. Abiola. If you've just tuned in, this is Radio Doctor on your Women Radio 91.7, Nigeria's first and only radio station for women and their families. And yes, we have with us Dr. Abiola Ajayi. He is consulting and advising on essential health screening every woman needs, pap smears, mammogram, and more. If you do have any questions for Dr. Abiola, do well to ring us on 07000 917 917 09155 917 917. Our toll-free number for women 0800 1235 917, and then we have our text and WhatsApp line 08155 917 917 0703 175 6537. If you do have any questions, you can ring us on those lines, or do well to drop a text or a WhatsApp message. Doctor, what is the recommended age for women to start getting mammograms, and how frequently should they be done?
Yeah, so, and for those listening that may not know, mammogram is an X-ray test. Excuse me. So the breast is placed in between two plates, and it's kind of flattened so it can be, all the tissue can be seen, and they take X-rays, and a radiologist or a doctor will read it. And we like those to start at age 40. But if you're a higher risk person, let's say you have a mother, sister, aunt, or first degree relation that has breast cancer, then you should start your screening earlier. I usually tell patients at age 35, because I have patients 35 and up with breast cancer. So at age 40, if you have no risk, or normal risk, age 35 if you have higher risk. And you're going to be doing a mammogram every 1 to 2 years. If you have a normal one every 2 years, is okay. And above the age of 50, I usually increase and go every year. All right, so every year up through the age of 65. But if a woman has a lump, or you feel a lump, or you feel any abnormal tissue, you should go straight to the doctor, and you may have a mammogram done then. But without any symptoms, age 40, every 1 to 2 years, and earlier if you're at high risk.
All right. What is the difference?
70% of breast cancer in Nigeria is detected late. And when you detect it late, you now decrease the chance of survival, by a lot. And in the States, mammograms have cut breast cancer deaths by 40%. So we need more of this kind of program.
All right. Thank you very much, Doctor. And I believe a lot of women who are listening are taking note of this. This next question, I had a conversation with someone who was actually very confused, so we had to put this. What is the difference between a mammogram and a breast ultrasound, and when is each necessary?
Yeah, the mammogram, like we described, that X-ray test is the best test we have for detecting early tumors or early cancers. But at times you may not have access to a mammogram, or you may have very dense breasts, or you may have a lump and you want to investigate, something suspicious. Then we use the ultrasound, right? So the gold standard is not an ultrasound. I try not to use ultrasound to replace mammogram, but if I'm not able to do a mammogram or the breasts are too dense, then we'll use ultrasound. And if somebody comes in with a breast lump, they're going to get an ultrasound immediately. That's the best thing for looking at the lump, looking at the size of it, and trying to make a decision about it.
Okay. All right. Thank you very much, Doctor. Are there lifestyle factors that can help to reduce the risk of breast cancer, aside from regular screenings?
Yeah, you're going to hear me talk about these kind of things a lot. Your diet, everything you put in your mouth makes a difference. And if we're eating a diet high, rich in what we call healthy fats and low in processed foods, low in carbohydrates, low in sugars, these all help. These all help reduce your breast cancer risk. Then maintaining a healthy weight. We've seen higher breast cancer in those that are obese and overweight. Of course, not smoking, not drinking excessive alcohol, and exercising regularly. So your weight, your alcohol, smoking, regular exercise, and your diet. A lot of us, especially in Nigeria, we eat a high carbohydrate diet, high sugar diet, and these things lead to not only breast cancer but other diseases down the road.
All right. Thank you very much, Dr. Abiola, for sharing with us. Now, what happens for a woman or for women with a family history of breast cancer? Are there additional screenings that they should consider?
Yes. If you have a woman that have a mother, sister, or a close relation that has been diagnosed with breast cancer, you usually should start mammograms about 10 years earlier. So, we said to age 40, before age 30 to 35 we'll start. And we should also consider breast MRI, which can detect cancers that a mammogram might miss. Remember, this is different than the ultrasound. And then there's some genetic testing. So we know at least 2 breast cancer genes and breast cancer gene mutations, which increase your risk significantly. So if you have those genes active, you can try and prevent the cancer from developing.
All right. Thank you very much, Dr. Abiola, for sharing this with us. If you've just tuned in, this is Women Radio 91.7, Nigeria's first and only radio station for women and their families. And we have with us Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital. He is consulting and advising on essential health screening every woman needs: pap smear, mammogram, and more. If you do have any questions, don't fail to reach us on 07000 917 917 or 9155 917 917. Our toll-free number for women, if you do have any questions, 0800 123 5917, and our text and WhatsApp line 08155 917 917 or 703 175 6537. All right, Doctor, what is a bone density test, and why is it important for women, especially post-menopause?
So a bone density test, or a DEXA scan, it's a test that measures the bone strength, and we're looking for something called osteoporosis.
Okay.
Osteoporosis weakens your bones and increases the risk of fracture. And if you I see it in the U.S. a lot, older women, I'm talking about 70s and 80s, and they have this hunchback, like the back is curved, right? And that's literally from the weight of the head bending the bones, and bones are not meant to bend. But if they're not dense enough and they're not strong enough, then of course they can. It's important because after menopause, your estrogen, which is a hormone, your estrogen levels drop, and as your estrogen levels drop, it accelerates bone loss. So all women over age 65 should have this bone density scan. And if you have risk factors like early menopause or family history, then I would start at age 55.
All right. Thank you very much, Doctor. How important are...
Can I give a story? Yeah, because, I'm just looking, a lot of people may not even understand the significance of osteoporosis. In Nigeria, it's underdiagnosed, but when you hear about an older person that maybe falls in the shower and now has broken their hip, or broken their leg, this is usually because of osteoporosis. In the States, 50% of women over the age of 50 will have a fracture due to osteoporosis. So this is a very common thing. It's underdiagnosed in Nigeria, but it's very, very common. Usually because we don't get enough calcium in our diet, and we don't get enough vitamin D in our diet. And both of those are extremely important.
And doctor, does childbirth have a way of impacting on, that outcome in women?
Yeah, it can, because of the hormone levels that change. We don't have statistics saying, you have this many children, you're going to have osteoporosis like that. But yes, it is implicated. And because of how it affects your calcium levels and vitamin D levels.
All right. Thank you very much, Doctor. So I'm getting this question here. I think it's from a man. It says, "Good morning. My name is Idris from Ikeja. I'm 39 years old. I'm suffering from weak erection since a year ago. Tests and treatment have been done, but still it persists. I need your support and advice. Thank you, Doctor."
Yeah, that's a good one. I see that more often. You said he's 39, right?
Yes.
Yeah. So, I won't know what tests he did. Maybe he'll call in later, but for anybody else suffering like this, at times it could be your testosterone levels drop, and they tend to drop about 1% a year from age 30, and then about 5% a year from age 40. So he may have early low testosterone. If you're obese or overweight, have diabetes or high blood pressure, all of those can lead to erectile dysfunction. And so those are the kind of things that we'd screen. It's another reason why you screen for not just women, but for men as well. If you catch erectile dysfunction, which is what he's describing, could be a early warning sign of something more sinister, high blood pressure or diabetes.
Okay.
So it's not just about taking a pill, right? Of course, we may use medication to treat it, but when you have that ED, erectile dysfunction, you need to do your screening and make sure there's not another disease under, and then you can now start your treatment.
All right. Thank you very much, Doctor. So I know you said something about, for in the man, if there is a case of erectile dysfunction, it could be a sign of something more sinister, like you shared. Then for women, what could they look out for as signs of more deeper lying health conditions too?
Yeah, heart disease is the leading cause of death for women in Nigeria and worldwide. So they're looking at regular cholesterol checks, blood pressure checks, and, we're trying to prevent heart attacks, strokes, kidney failure, those kind of things.
Okay.
So, we recommend blood pressure every year and cholesterol about every 5 years, but more often if you have an abnormal test or you have high risk factors. About 1 in 3 adults in Nigeria have high blood pressure. So if we have 300 million people, that's 100 million if they're all adults, right? Now 100 million of them would have. But only 30% of those people are aware of their high blood pressure. And the longer you have untreated high blood pressure, the earlier you die. There's direct correlation. So, and it's the same for almost all these diseases, that we don't diagnose them on time. None of us are not aware of it, and we don't screen well enough.
All right. I think that, Doctor, there are some people who really do not understand the figures that they're being told when they get their blood pressure screenings. Could you break that down a bit for them?
Yeah, you have two numbers. The top number, which is your systolic and you have your bottom number, which is your diastolic. All it means is what's the pressure in your blood vessels when your heart beats, which is the top number, and what's the pressure in your blood vessels when the heart is relaxed in between beats, which is the bottom number. So, we always hear the term 120 over 80, and it's measured in what we call millimeters of mercury. It's just a way, but the numbers are what's most important. So anything on top above 140 is high, and anything on the bottom above 90 is high. So you can have systolic hypertension, meaning you just have high blood pressure on the top number and the bottom number is normal. It's possible. You can have both of them abnormal, which is systolic and diastolic hypertension. And you can have just diastolic, where just the top number is normal and the bottom is abnormal. So you need to look at both numbers.
Okay.
There's some schools that teach you just look at the top, which is false. So you want to be hovering around 110 over 70, 120 over 80. Those are normal numbers. If you start seeing 130s and above, it means that you're you could fall into high blood pressure, and anything over 140 over 90 is high.
Okay. And then for the lower number, you said if it's lower than what?
If it's higher than 90, it's high.
Okay.
Right? If it's higher than 90, it's high. And there's a stage 2, which is what you call severe high blood pressure. If that top number is above 160, severe.
Okay.
You should be on your way to the hospital. If that bottom number is above 110, also severe. Go and see your doctor.
Doctor, there's also the part of low blood pressure as well. I mean, when you look at a lot of conversations, it's like it's more centered on high blood pressure. What are the implications for low blood pressure as well?
Yeah, I see that a lot in women, especially those that have anemia. So. That top number below 100 may be low. There are some people that have naturally low blood pressure, 100 over 50, 100 over 60, but I start worrying. I start asking questions, 100 and below 100 and below 60 on the bottom.
All right. Thank you very much, Doctor, for sharing this with us. Another part of this which you've highlighted is cholesterol screening. How important is this really? Because there's some people who may not understand this cholesterol in itself.
Yeah, cholesterol, which easy way to describe it is almost like a fatty gum that can block your blood vessels.
Okay.
And if your blood vessels get blocked, the organ or the muscle behind the blood vessel will not get any oxygen, and the muscle will die. So as soon as your blood vessel is blocked, and it's in a vessel that feeds the heart, that's now a heart attack. If a blood vessel that's blocked is one of the ones that feeds the brain, that's now a stroke. So the regular cholesterol checks are extremely important to reduce strokes, heart attacks, and if it's one of the blood vessels supplying the kidney, you can actually go into kidney failure. So we try and check that at least every 5 years. But if you're at risk, meaning you have high blood pressure, you have diabetes, you have a family member that has high cholesterol, then we try and check it more frequently. For me, every 1 to 2 years.
All right. Thank you very much, Doctor. If you've just tuned in, this is Radio Doctor on your Women Radio 91.7, Nigeria's first and only radio station for women and their families. It is currently 25 minutes to 11, and we have with us Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Dr. Abiola Ajayi is consulting and advising on essential health screenings every woman needs: pap smear, mammogram, and more. And I hope that you're getting a lot of knowledge from this discussed today. If you do have any questions for Dr. Abiola, please don't fail to reach out on 07000 917 917. 09155 917 917, toll free number 0800 1235 917. This number is for women to call in and ask their questions. And then we have the text and WhatsApp line 08155 917 917, 0703 175 6537. All right. I have a message here, and this one is All right, this one here is from Nancy from Ejibo. It says, "Hi, doctor. Please, I do not understand my body. Whenever I'm ovulating, a part of my tummy aches terribly. I don't know. Is that a symptom?" Okay, that's a question from Nancy.
Okay. Thank you, Nancy, for your question. During ovulation, usually we have something called a follicle or an egg is developing.
Hi, doctor.
Her ovulation period, she's having some.
Hi,
Hey,
doctor.
can you hear me? Sorry, somebody
Okay.
called.
Yeah, we can hear you now.
Let me block them. So during your ovulation period, you have eggs that mature and they swell, they get larger, and they form cysts. But we call them functional cysts, meaning they have a function. They're there for eggs. But if those cysts are large, then they can cause pain. And I see them anywhere from 3 centimeters and above. People can start having pain. So for Nancy, ideally, the most pain she should have would probably be around her day 14, the middle of her ovulation period. She should get a scan done at that time, looking for an ovarian cyst, and we just want to make sure they're not too large. And there's ways of suppressing them and ways of treating them, but you need to scan it first.
All right, thank you.
And it's best to scan. Sorry to interrupt. It's best to scan when you're having the most pain, because that's usually when it's biggest and it'll be easiest to see.
All right, thank you very much, doctor. Just to also support that question too, for this sort of symptom, doctor, is it what if the person sleeps up and wakes up the next day and you don't feel the pain anymore? You need to go for a scan.
Good question. For me, I would say if they had any bleeding,
okay,
and if the pain was so severe, meaning you couldn't go to work or school, you had to just shut everything down, then I would still have the scan. And I would note the day of my menses that I had that pain. So at least next month, in case there's nothing on the scan, we can come on that day. Usually somewhere between your day 13 to 15. Most women, it's on day 14.
All right. Thank you very much, doctor. We encourage you to keep your questions coming in so the doctor can, answer them right here on the program. Don't forget the lines are 08155 917 08155 917 917 and 0703 175 6537. So you can drop a text message or a WhatsApp message as well. Okay, so doctor, let's take a look at this conversation as well. What role does diabetes screening play in women's health, and who is most at risk?
Yeah, I like statistics, so you always hear me sometimes start with them. We have at least 10 million people with diabetes in Nigeria, and probably more than that, because many cases are undiagnosed. But diabetes increases your risk of heart disease, which we said is the number one cause of death, kidney failure, can even cause complications in pregnancy. So, of course, women are at risk for diabetes. Men are at risk too, but women should at least get tested every 3 years, starting by the age of 45. But if you have risk factors, meaning you're obese, you have a family history of diabetes, there's something called PCOS or polycystic ovarian syndrome, if you have that, or if you have a history of developing diabetes when you get pregnant, then of course we're going to now test you more frequently, and I would suggest every year. Right, so every year from age 40, you should at least, it's so simple to screen for diabetes. It's about a 1-minute test. You just prick your finger and check your fasting blood sugar. And if that's abnormal, then we can have another conversation. But if it's normal, you're pretty much good for a year unless anything else develops.
All right, doctor. Thanks for sharing this. I want us to move into another part of this discuss, and it has everything to do with pelvic exams. There've been people who tell women, "Oh, you need to do regular pelvic exams," but they don't know what to expect, especially for those who've never done it before. What conditions can they help detect, and how different is the pelvic exams from the pap smear?
Okay, so So a pelvic exam involves a speculum, which is an instrument that we use to open the vagina so we can look at the cervix or have access to the cervix.
Okay.
And it may also, so that's a visual inspection. And then you're also meant to do something called a bimanual inspection. So the doctor will insert 2 fingers into the vagina, 1 finger on top of the belly, and you're trying to palpate or feel for different masses. And a pelvic exam is checking for fibroids, right? And at least if I scan 4 women, one of them is going to have fibroid, at least, sometimes 2. So it's quite common. And then also for ovarian cysts, which are very common in Nigerians. There's something called, I've mentioned PCOS, and there's something called endometriosis as well. So both of these can not only cause pain, but they can affect fertility. So a pelvic exam looks for those. And you remember I said there's a visual inspection of the cervix. If you see discharge, cervical discharge, or you see fluid, then, that may be a sign of pelvic inflammatory disease, PID, or what people used to call toilet infections, but also could be a sign of sexually transmitted infections. Right, so a pelvic exam is extremely important. I see a lot of doctors here, even in the States, they don't touch the patient. So they sit across the table from the doctor. He or she asks some questions and just writes some drugs. It's important, especially during these annual or regular health screenings, that your doctor touches you, check the breast, check the pelvis, feel for fibroids and for cysts, and you may see a sign of something early that you can check and treat.
All right. Thank you very much, Doctor. If you've just tuned in, this is still Radio Doctor on your Women Radio 91.7, Nigeria's first and only radio station for women and their families. We have with us Dr. Abiola Ajayi. He happens to be the MD and CEO of ROA Specialist Hospital, and he's consulting and advising on essential health screening every woman needs, pap smears, mammogram, and more. Doctor, how often should women be screened for sexually transmitted infections, and which ones are most common?
Yeah, women should be screened for sexually transmitted infections every year, especially if they're sexually active, or if you have a new partner, or if you're engaging in unprotected sex. So minimum every year. And the key infections to look for, something called chlamydia and gonorrhea. Those are the most common. They can often have no symptoms, and any type of infection in a woman that's there for long or untreated can reduce your fertility or cause infertility. I see it every day of the week. A woman coming in, her tubes are blocked. Both tubes are blocked, meaning fallopian tubes are blocked. Eggs cannot come out of the ovary, and of course she can't get pregnant. And the number one cause of that is a poorly treated or untreated sexually transmitted disease or pelvic infection. So we talked about chlamydia and gonorrhea. Of course, HIV is recommended, and we're still doing this yearly. We've mentioned multiple times today HPV, or human papillomavirus, the virus that causes over 90% of cervical cancers, and their syphilis. I don't see it as much, but we still screen for it all the time. And hepatitis, which I see a lot of, hepatitis B and hepatitis C especially.
All right. Thank you very much, Dr. Abiola, for sharing this with us. Are there any recent changes in medical guidelines regarding women's health screenings that people should be aware of?
Yeah, the ones that I adhere to now, like for cervical cancer screening, we used to do every 5 years. Now we're recommending every 3 years, as well as doing HPV co-testing. So before, the pap smear looks for, like I said, abnormal cells, and but now we do it alongside with the test looking for the virus. And we know the types of, for example, now the HPV virus has over 100 strains. But we know the top 10 strains that can cause cervical cancer. So if you're screening for doing your pap smear and also checking for those viruses, it can help you with early detection. Mammograms, we used to say every year from age 50, but now we say every year from age 40. And for diabetes, it's anybody over the age of 35. And that's tied to a rise in obesity rates. As your obesity rates rise, your diabetes in the population rises. So we recommend age 35 for that.
All right. Thank you, doctor. And just a question. This one here says, this one is, how can women advocate for themselves in medical settings to ensure they receive the necessary screenings?
Yeah, I am very big on educating my patients, right? And the women should know, when you come into the doctor, you should know your health history. Like, ask your mother, did anybody in the family, were they sick? Did they have any cancer? Ask your father the same kind of thing. It's extremely important. And feel free. A lot of times women will come to the doctor and just keep quiet, let the doctor lead the entire interaction, and it's your visit, it's your patient visit. So don't have a problem asking about, hey, what screenings do you recommend? Insist on proper care, especially if your doctor dismisses you or seek a second opinion. Don't be afraid to. It's your body, it's your health, right? And another one that I don't mention often. If you're working for a company or for someone, ask about the health benefits. Often your company may have an HMO or some kind of plan for some of these screenings, and you don't have to pay for it, or you pay very little. So that's some of the best advice I could give.
All right, thank you very much, doctor. Okay, I have this question here. This one is from Amanda from Magwar. It says, "Good morning, WFM. Doctor, I would like to know, is there a side effect for women after having children? In my family, 2 women often act like they're crazy. I don't know if that is a major sign postpartum."
So that's an interesting question.
Amanda.
There is. I think we had it. We had a topic about it. I know it's on our social medias. There's something called postpartum depression, and that's depression after delivery. It could last anywhere from 6 months up to 3 years after delivery. It's well documented in the medical textbook. It's because of changing hormone levels. So and sometimes it can be tied to something as simple as vitamin D deficiency, right? Or sunlight. So if you have this person, let's put quote unquote crazy in the family, especially after childbirth, they may have postpartum depression. They should go to a qualified physician for screening. We're going to ask some questions. Do you feel sad most of the day? Do you have anxiety feelings? Ask some of those questions. And if you do, then we can treat it. No need to suffer like that in silence.
All right. Thank you very much, doctor. And yeah, this is actually where we get to wrap it up right here with you. But just before you go, I want to know, and for many women out there, are there major barriers preventing women from accessing essential health screenings? How can these be addressed?
There are a lot, and I'm just going to stress again that these health screenings, if we catch the disease early, we can prevent a lot of unnecessary deaths. Some of the key barriers, cost. A lot of women say they can't afford the test. Another key barrier, lack of awareness, which is why I love doing these programs with you. Many just don't realize the screenings are necessary. In Nigeria here, we have some cultural and religious beliefs. Some avoid screenings due to the stigma. Yoruba would like to say "Olamaje," and snap over their head as if that protects you from disease. But and then in the rural areas, there may be a lack of specialists or facilities. But the best way to address this is, number one, start with the awareness. We engage in, when I say we, ROA and Hope Medical, we do free and subsidized screening programs, so you can actually look for those. And we're undergoing a health education campaign, and as we get more doctors, I have two female doctors working for me now. As we get more female doctors, I think it will help women feel more comfortable coming to do the tests, and that's all we want.
All right. Thank you very much, Dr. Abiola Ajayi. MD and CEO of ROA Specialist Hospital, for today's free consultation and advice on essential health screening every woman needs: pap smears, mammogram, and more. Thank you so much for joining us today.
My absolute pleasure. See you next week.
All right. Well, for a consultation, you might want to grab a pen and a paper to get this one. You can reach Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital, on the following lines: 0913 579 5108. I repeat, 0913 579 5108. Well, for appointment and directions as well, you can reach Dr. Abiola or ROA Specialist Hospital at 0816 601 4901. 0816 601 4901. You can also reach Dr. Abiola on any of his social media pages below: Facebook, ROA Specialist Hospital; Instagram, ROA Specialist Hospital; YouTube, ROA Hospital; X, ROA Hospital; or visit www.theroahospital.com. I'll take that again: www.theroahospital.com. Thank you so much for listening today. Radio Doctor on Women Radio 91.7 is Nigeria's first specialized radio health program, broadcast from Mondays through to Fridays at 10 a.m. Do well to join us on Monday at 10 a.m. for another Radio Doctor special.